meetings and number. Great. Well, I want to welcome everybody to the Health Senior Social Services Committee of Community Board 8. I am Barbara Rudder. My two co-chairs are Lori Boris and Rebecca Danagor. First, as you can see, we have this wonderful district manager that makes our meetings seamless. He does magic with these Zoom meetings, and we thank him so much for all of his help along the way. This has been a very difficult few months for everybody, both emotional and in every way possibly. Every day, things are constantly changing, and yet we realize that they're all interrelated. And we realize that we are interrelated also. We no longer could say that one issue doesn't affect something else. So much has changed, and what we know is that more is going to change along the way. And we saw that our healthcare system failed all of us. So that is why our committee got together and decided to begin a dialogue about what are we doing now and what should be done in the future. And we're just so pleased that we have the two panelists. Councilmember Mark Levine is chair of the Health Committee. He's just been on the forefront of everything to do with health and during this terrible crisis along the way. He's going to talk about what we are doing, and I think he'll talk about tracing also. So we're very pleased with that. Dr. Robert Foley Love, we now know his name, is an EDD, and he's the Associate Dean of Columbia University Medical Center. His years as an educator, a researcher, and an activist fighting for healthcare justice and really human justice along the way. There are just too many to even begin to see. But as you heard me say before, I did watch Bob's YouTube speeches that he's given over the years. They are very enlightening. I won't say disturbing, Bob, again, but they are very enlightening. And yes, they are disturbing about the process of what we need to do along the way. And I think he will enlighten us. I'm going to ask the panelists to say, what can we as a community board do? Should be a resolution, follow-up meetings. I'd like some guidance because this is such a huge topic and we would like to do more work on it. So before we begin, and the council member is going to begin first, I would like Will to give us the instructions and the guidelines about what we're doing. And I will ask that the questions will be held until both panelists finish. Thanks, Will.
All right, well, very quickly, welcome to our virtual meetings. Everyone is muted and they're not able to unmute themselves. You'll have to, whenever we open the floor to questions, you'll need to raise your hand through using the participants. The participants menu can be found at the bottom of your screen. It looks like two people standing side by side with the number 33 right now next to it. The number will change based on the number of participants in the meeting. You'll need to open that, and once you have the participants menu open, you'll find the raise hand feature. If you click that, your hand will go up to the top of our participants list, and we'll be able to call on you to unmute you and let you ask your questions. But until then, everyone, you can chat me if you have a problem with the platform, or enjoy the show.
Thanks. Mark?
Well, thank you so much, Barbara and Lori and Will. It's great to be back to the CB8 Health, Seniors, and Social Services Committee again. And it's an incredible honor to be speaking with Dr. Fuller Love, who is really a legend for any of us who care about equity, racial equality, and healthcare. So, Bob, thank you for your years of work, and I'm really excited to hear what you had to say this evening. This is a momentous day for New York City and our fight against COVID, but I can't ignore the backdrop of the second pandemic that we're battling, which is the pandemic of police violence, which is directed disproportionately at African Americans in this city and this country. Coronavirus itself is very much defined by inequality, and I know we're going to talk about that. Disproportionate impact on communities of color in New York. And really, racism is unfortunately at root in both of these pandemics. And, you know, the health department today put out a statement very powerfully describing racism as itself being a public health crisis. And so these two topics really are combined. And I'm really happy to talk about each in this discussion. But focusing for a moment on the coronavirus pandemic, on this day in which we have moved to phase 1 reopening, what does it actually mean? Well, on the one hand, it's a great step forward. On the other hand, I'm worried that a lot of New Yorkers are overreading it. We may be done with the coronavirus to some extent as New Yorkers, but the coronavirus is most definitely not done with us. There are still 500 cases a day confirmed through testing on average here in New York City. That has to be considered at least still a moderate level event. And we have made great progress in recent months since the peak in early April, but we should all be really worried about a possible rebound. And so what does that mean about how we should think about risk right now, our own actions relative to coronavirus? And it means we still have to be cautious. It means we still have to wear face coverings and social distance where possible. It means we still need to be obsessive about washing our hands. And it still means that we need to think through the risk of social interactions. And I'm a believer of the harm reduction model, which Dr. Fullilove is well familiar with. But in essence, I believe that rather than the just say no approach of telling people they can have no social interactions, we need to equip people with the tools to understand risk and minimize it. And the truth is that if you're going to go for a walk or a bike ride with your friends, that's a relatively low risk activity. On the other extreme, a gathering indoors, a house party where there's loud talking, close talking is very high risk. And I've actually done some work and put out some information on this. Perhaps I'll put some links in the chat where we describe a spectrum of risk that New Yorkers can think about, whether it is meeting with friends for a picnic, going on a date, or today I even posted on riding the subway, which I believe recent research indicates is probably less risky than we understood 2 months ago for a variety of reasons, which I can talk about. Again, not zero risk. And so people who are vulnerable because of age or underlying condition need to be extra cautious. But we need to give people the tools to understand this moment. You know, I'm happy also to talk about risk and the protests which I strongly support, protests which I have participated in. And I think people who are there understand the risk, and they are choosing to take that risk because there's a higher imperative of battling racism and police brutality, which again, itself is a public health crisis. And I think those two battles are deeply intertwined. And I can talk more about that. But I do want to focus now just for a minute before I pass it on to Dr. Fullilove about the critical public health infrastructure to keep us safe now that we have begun to reopening. And the pillars of that are testing, contact tracing, isolating, and quarantining. What does all that mean? Well, testing, I'm talking about diagnostic testing, which is a test to determine whether you currently have the virus, as opposed to an antibody test. We can talk about that if you want, but diagnostic testing is key to slowing the spread, and it makes possible the other components. And we have dramatically expanded our testing capacity in New York, 240 locations now, to the point where we are not actually using all our testing capacity on a lot of days. not enough New Yorkers are seeking tests. We changed the criteria. Anyone can get a test. It doesn't matter whether you have symptoms, whether or not you've been exposed, what your occupation is. Anyone can get a test. It's free if you don't have health insurance at almost all these locations. And really, people who have been exposed should probably do this on a regular basis. We have the capacity for now. We will need to grow it for sure, but that's a key message. If you test positive, and again, about 500 people a day are, then you're going to get a call now from a contact tracer. Someone from the city who's going to interview to understand first, what are your medical needs and are you safe? And secondly, who might you have been in contact with, which they would define as 10 minutes or more within 6 feet. So this is commonly at this point, someone you live with, or maybe if you're back in the workplace as an essential worker, you're at a supermarket, someone you work with. And then the contact tracer will call those individuals and warn them they might have been exposed. Not revealing your identity, there's lots of privacy protections. But then the advice to those individuals will be to quarantine. And so this gets to the key point of quarantining and isolating. People who are sick should not remain at home in crowded apartments. That's where the virus spreads. Some of you know I had the virus. I'm obviously fine now, but I did everything I could to keep my family from catching it. And my wife had a horrible case that she caught from me. She's doing fine now as well. The kids were pretty sure had it as well, although they're younger and they didn't have many symptoms. As an aside, I got the antibody test and we'll be donating plasma next week, which is very exciting. But I tell that story because even for someone whose job it is to understand how to keep people safe in small apartments, I couldn't do it. It's almost impossible. The solution is isolating in a hotel. We're offering those hotels to people for free in these kind of conditions. And all your needs are provided, food, etc. We are, unfortunately, again, very few people are taking us up on that. This is a recurring theme. And so my exhortation to you as a community board and as leaders and people who I think have the trust of the neighborhood is you need to be talking about this as much as you've been talking about the census. We need to rally people to get tested, to talk to tracers when they call, to isolate if they can't safely do that in a small apartment with a lot of people, especially some who might be vulnerable because of age. And lastly, to quarantine if they learn from a contact tracer that they have been exposed. That message needs to be on everyone's lips. Right now, if we did a poll, probably 98% of New Yorkers would barely know what contact tracing is. And that's a huge problem. We need buy-in. So I'm going to pause at that point. I'm excited to hear from the professor, and of course, excited to talk about all of you in the Q&A portion. So back to you, I guess, Madam Chair.
So can you hear me? I don't know.
Yes,
Thank
Barbara.
you so much. That's great. I am going to, well, we'll ask a question after. Dr. Fullilove?
So thank you very much. And Councilman Levine, anytime you want to apply for a master's in public health from Columbia University, I'm definitely the guy you want to see. That was terrific. So I came prepared to say what he said. And because I think he did a brilliant job of covering what I would consider to be the most essential elements of what we in public health want the general public to do, let me focus on some other things that I think connect me to what I hope is the audience out there. So first and foremost, you should know a little bit about me because as was pointed out, I'm actually a Jersey guy. I have been teaching at the Mailman School of Public Health at Columbia University since January of 1990. So I've been around and I've been actively engaged in public health as it has impacted the city of New York. But maybe the most relevant thing about me isn't so much what I've done at Columbia. It has everything to do with how I connect and identify with the folk of you who are part of the viewership for this webinar. I was born in 1944. That means that I just celebrated my 76th birthday. I'm somebody that was told, because I'm hypertensive and because I live in Washington Heights. I'm speaking to you now from 169th Street, right around the corner from the Columbia University Medical Center. I was told that I was one of those folks, it's like, maybe you want to not go out so much. Columbia University has shut down. I've been teaching students via Zoom for almost 3 months now. And like everyone else our age, everyone else this age, I've been careful about what I've done for a variety of reasons that I think are relevant for all of us. I'm from a family of physicians. My grandfather was the son of slaves, born in Mississippi in 1875, became a physician in 1896. He started practicing medicine in the state of Mississippi. He did so for almost 60 years. He is someone of some note because he was the medical director of one of the very few hospitals in that state that offered care to African Americans during the time when Jim Crow laws basically segregated African Americans from healthcare. His wife, my grandmother, died in the 1918 influenza epidemic. My father, who was born in 1910, I believe, really made a decision to enter medicine as a profession because his father, the physician, couldn't save his mother. We never spoke about that as a family, but I'm someone whose family was already touched by a viral pandemic. And now I find myself in 2020 thinking about what has happened in the succeeding 102 years that has put us back as a world, as well as a nation, in a situation that we thought we left behind. My father practiced medicine from 1934 to 1986. At his death, he was the emeritus chair of the North Jersey Medical Society in Essex County, northern New Jersey. He had a distinguished career and was someone who, when I started doing HIV/AIDS research in 1986, was very encouraged because with this very unusual last name, Full of Love, the irony in the family is that he sent all of his 4 children to prep school and college by treating gonorrhea and syphilis. I've been trying to ask my dad, do you see sort of the irony in all this? Our last name is Full of Love and you treat what exactly? He looked at me and said, as a father says to a son, and your point is? However, it's not been lost on me that for the last 36 years, I have been engaged in watching viral epidemics because my entree to public health, as I pointed out, was HIV/AIDS. I'm also somebody who's a veteran of the civil rights movement. In July of 1967, as a field secretary for the Student Nonviolent Coordinating Committee, SNCC, which some of you are actually old enough to have known about, I was involved in the riots that tore Newark, New Jersey apart. As is the case with what we're seeing in this country now, that particular urban rebellion was sponsored by police violence. 53 years later, it's, as you can well imagine, absolutely astounding for someone my age to have the sense that I'm in a time machine, because all the things I've seen, as has been the case with many of you, and all the photos that have looked at this situation that the country is in, if you recall the long, hot summers, the term that used to be used to describe urban riots in the 1960s from 64 to 68, you're like me and having this sense of deja vu. You know, it's like, damn, I thought we were past this. Why aren't we done with this? And the notion that the 2 themes I've just cited are combined, a substantial portion of what we're looking at is urban unrest that had less to do with what happened to George Floyd. Let's be clear, that was definitely the spark. But we're also looking at a nation that simply was not accustomed to having 8 weeks spent indoors while the economy burned up before our very eyes. So folk who have been angry at government about everything from inability to manage this pandemic to losing jobs, income, and being hungry has meant that we have the perfect storm from a public health, military, and may I say civil standpoint. We have civil strife that has been so extreme that our leaders are panicking and thinking that the military has to put it down in the midst of a democracy. But it's all in response to something that was created in part by a viral epidemic that we were not prepared to meet. It was made worse by the fact that, unlike what happens in countries in Western Europe, I spend a lot of time in France, so I think I can speak about this with some authority. We have to pay for healthcare. In countries in Europe where healthcare is basically covered by government, a lot of the strain that we saw on our system simply didn't exist because people didn't have to wonder whether or not they should choose life or death based on whether or not they had the cash to pay for medical care. So the perfect storm isn't just that we had a pandemic and civil strife. We're in a system that simply was absolutely unable to care for a crisis that would hit that portion of the population that had the least access to medical care and the least set of resources, economic and social resources, to pay for the care that they needed. Add to the fact that in this city alone, we had serious trouble getting testing and all the appropriate access to medical care to the neighborhoods that were hardest hit. Means that a lot of people in these neighborhoods feel very deserted. So although they may not be in the streets worrying about what's happening with the cops or protesting all the things that we worry about in today's society, they certainly have been suffering the consequences of feeling abandoned and, for all intents and purposes, left behind. Councilman Levine has been really, really active in my neighborhood because here in Washington Heights, in a tour that we took of the neighborhood on Saturday with two of our elected officials, what I saw absolutely astounded me because more than anything else, I saw hunger. I saw a large number of folk who are struggling with what we call food insecurity. I went to 159th Street where they have folks distributing food, and I saw 2 blocks worth of people standing in line with masks, waiting patiently to get something that would allow them to feed their families. The public health person in me wondered, what about the folk who had to stand in line, having to hope that the social distancing would be enough to keep them from being infected? I thought about what it meant to make a choice between getting enough food to feed your family or putting yourself in a situation where you might be at risk for a virus that has scared everybody to death, and with good reason. What I think I'm describing at this moment is something that we as citizens have to understand as a result of the crisis that's at our doorstep. We have to be concerned about taking care of ourselves, especially if you're like me, the senior citizen who has every reason to be really careful to not become exposed to something that could prove to be very deadly. But we're also members of a democracy that is, in our lifetime, having large numbers of people in one of the richest cities in the United States, if not the world, suffer the vision of people on our streets who are hungry because they've lost their jobs or worried about being kicked out of their apartments because they can't pay the rent. In addition to caring for ourselves, the question that I think we all have to ask is, what are our responsibilities as citizens? What are we going to do to demand change when the November election comes about? I'm not trying to be a politician at this point. It's not about candidates. It's about people showing up aware, as I know we all are, and you don't need to hear this from me, that this is an election that's going to decide the future of our country. And what we all have to keep in mind is exactly the nature of the crisis that we're facing now. The crisis that is created by a virus, the crisis that's created by our government's inability to react, and a crisis that comes about because we simply don't know how to chart a course for the future that will keep us and affected populations safe. I want to suggest that thinking about those things and acting upon them in the ballot box and other is a real requirement for all of us as citizens. And let me stop there.
Thank you, Bob. I'm just going to ask beforehand, what do you think we can do next? Let me ask Bob first. What is it that we as a community board, we had, what, about 30 odd people here today. Is there something we should be pressing our elected officials to do? Is there something else that can be done, do you think? And is there any hope?
Yeah, there's always hope. And I think what happens is forums like this that are designed to make sure that people are informed and engaged are really important. If there's one thing I'd want people to do, it's to stay informed and to be capable of making a judicious and I hope well-informed judgment about some of the decisions that are going to be put before us. What I have seen over the course of the last 3 months is that the voice of the people is powerful. When people sign petitions, folk listen. When folk demonstrate, look at what's happening. I haven't seen this since the 1960s. Irrespective of our age, I believe that what we have to do is not be on the sidelines. We can't be bystanders. The country is changing before our very eyes, and we have a simple choice. Are we going to be in it, or are we going to be watching it? I think we should be in it.
Meaning protesting?
Meaning that wherever it's appropriate for folk like us to become engaged, whenever it is demanded of us that we lift our voices, that we be present, that we vote, that we send money if we have it, that what is called upon is that what I worry about most is everybody who is binge watching Netflix and is becoming more and more and more abstracted and set aside. The terrible thing about, I'm living by myself. Saturday was the first time in 9 weeks that I had gone below 165th Street. And I understand that there's something great about being here. This is the sabbatical that Columbia never gave me. And the temptation is to never get engaged, because isn't life interesting when viewed from the spectator seat that all of us have? This is the moment when we've got to be involved. The temptation to be a spectator, I think, is something we have to abandon. Being engaged is what I think a democracy of ours demands of us. And that's why I think meetings like this are important, because we're the folk who want to become engaged. And we should.
Thank you. Will, are you going to call on people? Are there questions?
There are questions. The first one comes from one of our second vice chair, Tricia Shimamura. Tricia?
Hi, sorry about the non-video. Thank you so much, both of you, for joining, for speaking tonight. I thought you were excellent. My question has to do with long-term solutions, and I'd like to ask Councilmember Levine first, and then Professor Foley-Love, if you could also speak to this. A lot of what you described in terms of the systematic inequalities that contribute to our public health crisis are things like air quality. I think Professor Foley-Love talked about food insecurity. Obviously, housing may be a concern too. So I'm wondering if you can just talk to us about some long-term solutions to address some of those other systematic inequalities that ultimately contribute to a poor outcomes in public health.
Well, thank you, Tricia, for that very good question, and it's great to see you. This pandemic really has exposed the profound inequality in healthcare, in housing, in employment, and it's hard to think about upsides from the hellscape we've just been through, but I do feel like there's going to be momentum to start addressing some of these profound inequalities. Much like after 9/11, there was attention and resources to national security, to some extent too much. That's another discussion. But I do think now it's impossible for New York City, for America, to ignore this. And okay, it starts with unequal access to health insurance and health care. And as a proponent of single payer, I think the argument for that kind of solution is greater than ever, or some way to get to universal health care. We have had terrible inequality in our hospital system exposed, where the independent nonprofit hospitals that are in low-income neighborhoods like Jamaica, Queens, or the South Bronx, or the Far Rockaways are under-resourced, and were overwhelmed in the very neighborhoods that were hit hardest by this pandemic. The inequality in housing in New York City has ended up driving this, overcrowded housing conditions. And the underlying determinants that have made people vulnerable, like diabetes and hypertension, are directly related to access to healthy food, access to preventative medicine, primary care. And we're going to have to double down on our efforts to tackle those problems. There still are food deserts in the city. It is still too expensive and too difficult to get healthy, fresh produce in some neighborhoods. And there are still too many New Yorkers who go without primary medicine, for whom the emergency room is their first line of defense. And that has disastrous consequences for their health. Also, by the way, it's terrible for hospitals because it's so expensive. So we're going to have to invest massively in all of these systems for the long term, but also, Tricia, for the short term, because, you know, we might have a second wave. We are praying we don't. We are hoping we don't. But we can't rule it out. And, you know, that might come in August. We don't know. You know, again, we pray it never comes, but we need to be working now to respond better if there is a second wave than we were able to in the first wave.
Let me say for my part that part of what I didn't address is the fact that, yes, my entire career in public health has really been focused on the health disparities that became vividly apparent when you looked at where was COVID-19 hitting and who was it impacting. It became very clear that chronic disease conditions that are rampant in Black and Latino communities were exactly the places where you had the highest level of mortality. And when I think about what are we going to do next, I've been at this for a long time. My family has been at this for a long time. It isn't as if since the end of slavery, folks haven't been screaming about the fact that you have a healthcare system that at its worst segregates, is discriminatory with respect to income, sexual preference, you name it. And as a consequence, when we think about something that's broken, the healthcare system often comes up first. And what I worry about in a webinar like this is that so much of the language we use to describe the system makes it apparent to the average citizen, well, isn't that for experts? What do you want me to do? So I've always worried that, you know, at the level of solution, we're really talking about drilling down very deep and looking at careful issues related to how do we finance healthcare? Who gets access to it? Where do we place hospitals? How do we distribute the goods and services that medicine and public health are in a position to provide? Part of what we've also seen in the last couple of weeks is how the distribution of healthcare centers that people need to have access to aren't evenly distributed. Some populations get access to them much more rapidly than others. And one is almost breathless trying to figure out, if I were going to tell the average citizen, this is what we need to work on, the choice is absolutely vast, which is why I've tried to use general language about people staying informed. And when policy decisions come up, that people are aware enough of the issues, as I think Councilman Levine has tried to lay them out, so that they can make those judicious choices about what we would like our policymakers to do. I love New York because our elected officials like Mark are here present in the public, trying to not only say some things that he knows we all need to hear, he's also someone who's in a position to listen so that if you give him orders about what to do, he knows that he's got the backing of a constituency that is informed, is aware, and is able to really sort of separate the bull, if you will, from the essence. And I think that that's what's really called upon. And I'm inviting you to any of my lectures and I can go into detail about the dynamics of the epidemic, how populations of the type that have been hit hard and how that actually works. I can give you the modeling that will tell you how much and to what degree I think it's almost inevitable that we will have a second and third wave. Read the great influenza to see how the second and third waves of the 1918 Spanish flu epidemic were in fact the problem that we had. We can think about something as simple as vaccinations. Okay, we get a vaccine. What's our history as a nation in the last 5 years with having people take the flu vaccine every time it comes around in the fall? How many of you out there religiously go to get the flu vaccine, and how many of you are kind of depending, not me, I'm going to take my chances? What happens when we have a vaccine that's rushed into treatment and that will get touted by Donald Trump as something that you should take? Without saying anything at all about that, I just want to say that if taking a vaccine requires that the public trust whoever it is that's giving them the message that they should do this, I think that's going to be a hard message to sell. And in settings like that, where we have a public health imperative, you should get vaccinated, but we can't rely on our leaders to have the trust necessary to make sure that we will follow what it is that they say. It becomes upon us, regular citizens, to do what is necessary to keep ourselves and our neighbors safe. So being aware of these issues, staying on top of them all, listening carefully to all of the policy debates, and where possible, weighing in with your vote, your voice, I think that's what we have to do next. And we can get down to the technicalities. What should it actually look like? What should the details be? What should the architecture of a new healthcare look like? We can get to that later, but for the moment, I think we have to stay engaged and involved.
Can I say something? Thank you both, Mark and Dr. Fullilove. We really appreciate your coming and enlightening us on these issues, and it's just so very important. I actually have a two-part question, and I'm not sure who wants to answer which part of it, but just the way that the demonstrations have shown, I think, obviously, how long, these issues have been, bubbling up and coming to the surface, and that's what Mr. Floyd's death, brought to the surface. But it's clear that it's been going on for a very long time. So the way people have, the greater population has finally connected the dots, that this is really something that's been going on for a long time, and now we're, kind of like putting it in your face. Is the same thing going to happen with the issue of healthcare? Because I think that healthcare is another issue that it's been, horrible for a really long time in this country, and we really need to get it together. People need preventive care. People need to, for all the reasons that you said about the, people of color having a harder time with it. Anyway, so that's my first question. The second question is, I am really worried about a rebound as well, because I feel like we're in stage one, and I went outside. I too live in Washington Heights, and I went outside, and there were so many more people without face masks today than there were just, yesterday. And I feel like there's a false sense of security with this, that like, oh, it's over, like we're over. So I guess this question would be to Mark, is the city going to do anything to sort of, say to people, look, it isn't over? I put signs in my elevator saying like I was going to spray all the like buttons in the elevator. They took those down, it's like, so I feel like a lot of people are just kind of putting their feet up and saying this is over.
That's very worrisome, Lori. It's not over.
Yeah.
500 new cases a day, still hundreds of people in ICUs in hospitals in New York City. And I know that we hope that warm weather means the virus goes away, but look at Texas right now, look at Arizona right now, look at Brazil and Ecuador right now. And there's just no evidence to support the concept that this virus goes away in warm weather. And furthermore, as Bob mentioned, it could still come roaring back in the fall as it did in 1918. But even just talking about the short term, it's true that we have, despite now 5 weeks since the start of May and warm weather and people getting outside more, we haven't seen any kind of rebound in the numbers yet. They're sort of plateaued and maybe bouncing around a little bit, but we haven't seen what we fear yet. But we can't let our guard down, and people need to wear face masks when they're in public, period. And people need to be cautious about social distancing, and they need to think about the surfaces they're touching and cleaning their hands, including, yes, buttons in your elevator. And it doesn't mean that we all need to be locked up in our apartments with no social contact, particularly if we're not in one of the more vulnerable categories. The city is going to have to up its game on communicating about this, communicating about contact tracing and quarantining and all the other things that I mentioned. We can't wait until we're in the midst of another wave to do that. We have to start that now. And so I'm really sounding the alarm on that. But in the meantime, keep cleaning the buttons on your elevator, Lori, even if you don't get credit
I have a
from
little
your
spray
neighbor.
bottle. Thank you. Dr. Fullalove, can you address the other question? About, yeah.
I am, as always, really concerned about how these things play out, because what I see more than anything else is that we believe deep down inside that human beings are rational, and that if we give them messages that are very clearly articulated, they'll go, oh, I see, and then they'll do what is necessary to protect themselves. What I think we've seen in the last couple of weeks is one simple fact. Telling people that what you do could kill you isn't enough.
Yeah.
I mean, I don't know how much it should be clear that if the Prime Minister of England can get sick and be hospitalized, you really should worry about what this could do. Nobody is invulnerable. But what we're also looking at is the fact that if you've got to make a choice between getting a paycheck, not being homeless, being able to eat, in all probability, you're going to choose immediate gratification before you choose the choices that will give us long-term protection from something like exposure to this virus. So as long as the economic consequences of staying inside are so problematic for folk who need to be outside, there will always be exposures, and there will always be opportunities for folk who come outside to be impacted and infected. I don't know how we do that. If the unemployment rate in this city is as high as I think it is, anybody who is making a choice between starving, being homeless, whatever, but who now has an opportunity to go out and get a job, whether it's public facing or not, whether or not it's going to expose them to the virus, is probably going to choose the job. And they'll understand that they are at risk, but they won't see themselves as having much in the way of options. The situation that we're in now is one where we're trying to hope that it's all about public policy. It's all about things like having enough physicians and enough emergency rooms and enough hospital beds. But I think more than anything else, the economic damage that has been done by this pandemic is what's driving people to make many of the choices they make about being exposed to risk. As long as the economics of the household and the community are such, we're going to always choose to be fed. We're always going to choose to be housed. We're always going to choose to do something that will allow us to maintain some semblance of a normal life. And we'll accept the risk that maybe, just maybe, I'll get this bug that might kill me. I think if that's the way we understand so many people are making decisions, we'll also understand why the second wave is almost inevitable. Because it's not enough to just tell people stay inside. They won't, for many instances, they won't have a choice. And if they don't have a choice, the exposure becomes what it is. I'm going to start to repeat myself. I think you get the point.
I do. Thank you.
I have a question as well, but I was thinking maybe we could first let the members, the people from the public who are not board members, ask their questions first, because I want to make sure that they get to participate.
That's a great idea. And just a reminder for anybody who may have missed it at the start, we're taking questions only through raising your hand. Chatting them to me is not going to get them heard. So you'll need to find the participants menu and use the raise hand feature, and we'll go on call people in order of raising their hand. If you're on the phone, it's *9 to raise your hand.
And just a reminder that anything you send in the chat is a public record as we're adjusting to open meeting laws in this new digital environment. So I just want to make sure people know that.
And with that, I'll call on the next question unless Barbara had something.
You want to call on the public first?
Yeah, that seems great. So I have a Steve who has his hand raised. Steve, I'm going to unmute you. You may have to select something on the bottom of your screen to confirm it.
I Can you hear me?
Yes.
Yes.
So thanks very much for this webinar. Very much appreciate it. I actually have a specific question related to healthy public transportation that I've been trying to find out an answer to for a while now. I have to take the bus or the subway occasionally. I don't like to. I'd rather walk if I can, but sometimes I have to. I've read a number of research articles throughout from various places in the world, talking, especially as we get into warmer weather, talking about air conditioning and talking specifically about whether air conditioning should be set to, as you do in your own car, to recirculate or to allow fresh air. And that virus or viral particles will transmit much more vehemently if the air conditioning is set to recirculate rather than to allow fresh air to come into the system. I've called the MTA about it. I've talked to bus drivers about it. Nobody has the answer. Seems to be no set policy, at least in New York at this point. If there is, I'd love to hear it. And I asked Mr. Levine, for example, on the council, if he could look into it. And I wonder what Dr. Fullerlove's position on this is as well. Because to me, it would seem, I know that we can open these little windows in the buses to get some fresh air in. And I know that when the doors open, that helps a little bit. But I think otherwise, when we're taking these buses or subway cars, we're in a closed system. And even if we're wearing masks, they don't prevent everything, especially if there are people in the subway cars that aren't wearing masks. Thank you.
Sure. I don't know if Dr. Fuller wants to weigh in.
Yeah, let me do that because folks, I see it's 7:25. I'm due at another one of these town hall meetings at 7:30. What I'd love to do is share with you a piece that is a blog that has been shared, I think I'm accurate with this, 25 million times by Aaron Bromage. Some of you may have read this. This is a biologist who's probably done the best and most accessible work to describe what happens when a virus, a SARS virus like COVID-19, gets into the air, is aerosolized. Everything that you've described is a problem for a variety of reasons. If you have a super shredder who is shedding a lot of virus, the longer you are in a closed environment breathing the air that this person is expelling through cough, sneeze, or just simple breathing or singing or hollering, the risk goes up. But if you've got a short duration of time when you're in a public setting where the air is not circulating that well, you're probably going to be okay. What folks worry about are long-term exposures of the type that occur in choir practice, for example, because they've looked at a lot of super shedding events that come down to something like that, where people singing expel an enormous amount of virus that circulates for 2 hours. They're there, they're singing, they're inhaling, they're interacting with each other. That's a danger. You're in a subway for 20 minutes and you're wearing a mask. You're probably not going to get the virus from the pole that you're touching. We're kind of clear that that's not a way in which it gets transmitted. You are at risk for being in the presence of somebody who's shedding a lot. But if you're not exposed for a very long period of time, you should be okay. Does that mean that you're at zero risk? No, I did not say that. I'm just saying that the risk is at a level that for somebody who has to travel, it's probably okay. This is like abstinence only during the HIV/AIDS era. You want not to get HIV? Don't have sex. You want not to get COVID-19? Stay inside, never go out, have everything brought in. You know, I mean, technically speaking, isolation is the one thing, like abstinence with STDs, that we know will keep you safe. Then we're starting to talk about what's the level of risk. And I think you're right to worry about risk in settings where air circulates, where people don't have freshened air to breathe. You would love something like what happens in an airplane where you actually have that rate of exchange and where the filters really are probably pretty good. You're better off in an airplane in some settings than you are in a subway. But for the most part, there's no way to guarantee that you're going to produce a risk-free environment as long as somebody with the virus is present, undiagnosed, untested, and shedding. So what we're talking about is reducing risk, not eliminating it altogether. And I believe that for the moment, if you're not in a subway car for a long period of time, you should be okay.
I was just suggesting the possibility of there being procedures that would allow, that would be set by the MTA to have air set to allow fresh air to come in rather than recirculate. I believe that's a switch that you can set, just like you can set it in your car. And so that's what I was trying to bring up.
Yeah, no, and I'm pointing out that I know what the nature of the risk is. And I'm supporting your view that it is about circulating air and exposure. Anything that reduces the exposure that's present with circulating air is a good idea. Can it be arranged? I believe so. I'm not an engineer, but if they can do it in airplanes, one wants to believe they can do it in something like a subway car. But at what cost? And who's going to pay for it? I keep looking at politicians crying, dude, I'm broke. I can't pay for anything. So of all the things that you want to choose to help keep the public safe and secure, let me make you the emperor. Which one would you choose? I myself, I'm not really sure. And I think that what I've talked about when I described the failure of us to have leaders who are really thinking about these things, we're still in the midst of crisis management. Nobody's doing long-term planning. You're asking what I think is a long-term planning, permanent solution kind of question, and we're not there yet. And as long as we're in the midst of this crisis, it's going to be a while before issues like the one that you very correctly described as being essential. It's going to be a long time before they're really adequately discussed. It's almost 7:30. I am so sorry.
Thank you so much. You were wonderful, and thank you for everything you've done.
Thank you.
I do want to hear your lectures.
Very good. I'm accessible. Anybody wants to find me, you can't say with a last name like Full of Love and Google that you can't find me. Thank you all for everything. Be well.
Thank you.
Thank you.
Rebecca,
I see another, I think Meryl has a question.
Yes. Meryl, I'm going to unmute you.
Prospect of a vaccination and the distribution. I know that the hard stuff is actually going to the child clinics and to the public schools and or various and sundry health establishments in and around the city, Medcare and so forth. As opposed to saying just go into the Dwayne Reed or Walgreens to get your virus, your flu shot. Would there be a vaccination? I think that's very important right now in terms of distribution, in terms of expanding what we have in the way of public health. God, nobody knew public health would become a primary concern. I mean, we really haven't felt that since the epidemic in 1918 and then smallpox and measles and everything else that I went through when I was a kid, but the kids are vaccinated for now, and that even, in fact, I was too. So who am I talking to and who am I addressing this vaccination distribution public health problem to? Anybody want to reply?
Mark, I think, is Mark still there?
Yes, I'm happy to weigh in. I didn't hear every word of your question, Meryl. I think what I understood, and I'll repeat it because other folks might not have heard. I think you're raising a really good point about how do we actually get a vaccine to people when we develop it for coronavirus. And that is actually such an important question that somehow people are forgetting. If you want to know when we can return to something like normal safety, the question isn't just when can a vaccine be proven to be safe and effective. It's when can we develop or when can we manufacture billions of doses of it and actually deliver it to people? Probably, by the way, twice. The thinking is you're probably going to have to need 2 doses. And that's an enormous challenge. We don't have currently the capacity to produce billions of doses of any vaccine, and it will stress every system you can imagine, including the containers in which it's transported in, and thinking about the staffing, et cetera. And let's remember that the flu vaccine is nationally only received by about 50% of Americans. In New York City, it's better, probably more like, I think maybe like 60 or 65%. but there was one terrifying survey that showed in which only 50% of Americans responded that they would get a coronavirus vaccine. And so there's yet another concern. And so people who say, we're going to have a vaccine by the fall or by the end of the calendar year, I think are not only assuming we get a lot of breaks on the science, which may happen, but also might not, but they're also forgetting all the other real world challenges of actually producing, deploying, and convincing people to take it. And so I think that we should probably, while hoping for a breakthrough that comes sooner, we should probably prepare that we still are a year away from having the vaccine actually deployed. I mean, and if things are not going our way, potentially longer, but we're going to be in some in-between state between now and then. Not as bad as it was in March and April, but not quite back to the normal level of risk, probably, barring some sort of unforeseen breaks in this virus that we don't yet know about.
Thank you. Will?
Next, we have
And
one of our new
just
members. Oh, sorry.
Oh, sorry. Just a quick reminder that you have to digitally raise your hand instead of just raising it here. I think I saw at least one person do that, just so that we can see you and call on you.
So it's participants, and then you click on the hand raising. There's a hand that raises. Okay. Will?
I'm just seeing if somebody has a question. I can't tell. Ann Kaplan, do you have a question? Are you trying to raise your hand, or are you just applauding?
Yes,
I think
she has a question.
Yeah, unmute.
Okay, I'm gonna unmute you.
Okay. All right. I mean, it's a little bit redundant, but I just find it kind of shocking that there's nothing to be done in the city about enforcing people to wear masks. I walk around and I just started going out. I always wear a mask and people don't wear masks. Am I at risk to get something if I go near somebody that doesn't have a mask on walking around? I mean, everyone's so nonchalant about it, like it's not, like the virus doesn't exist. Can't the city do something to enforce this?
Well, we have to be really careful that it doesn't become another unequal, overly aggressive enforcement burden on communities of color, as it was in the early weeks of social distancing. And
Well, this is on the Upper East Side. You know,
understood. But so as it,
people blatantly walk around without masks, and they really just don't care. You know, maybe when you're younger, you don't care, but when you're older, it's scary.
well, young people need to care too, because there are 30-year-olds who have died from coronavirus, tragically, but also because people who don't get very sick themselves, as everyone I think here knows, can pass the virus on to others. And that 30-year-old might have a loved one in their life who's vulnerable.
Mhm.
I think there's a really simple, powerful fact that might convince people they need to wear a mask, that we don't know who the people are who have the virus right now.
Right, I know that, but they
And
walk around without.
in fact, those people themselves might not know they have the virus because of asymptomatic infections.
But you can't say anything to somebody because they could come spitting after you. I mean,
well, right, that's true too. But the truth is that when you're interacting with people in the public, you have to assume that there's a possibility that someone is contagious. It's just a fact. Now, if and when, I'm going to say when, because we need to do this, we have a really good contact tracing program going, then you'll start to have a lot more confidence that the people who are contagious, even asymptomatic, we have identified and they're quarantining. But we don't have that today.
Right,
And
so it's going to spread more.
We're pretty far from it.
It's going to spread more because people just don't seem to think it exists. And I mean, a lot of people, I see them on the street, people talking to each other without masks on.
Yeah.
Construction workers,
Police officers.
Yeah. I mean, I would give them a mask if they would wear it. But these are people I've seen that could have a mask and they're just not wearing a
They
mask.
need to, and we need to deliver that message, all of us.
You know, I've seen a lot of, I quote, white privileged people walking out of the apartments on East End Avenue, getting into their cars, walking past the poor doorman without a mask on.
Not good,
All right.
not acceptable.
Will? Will?
Yes, sorry, I had muted myself. Thank you, Anne. So I don't see any other members of the public who have their hands raised. So I'm going to go back to board members. The first one up is one of our new board members, Brian Correa.
Hey, Congressman Levine. Appreciate, and this question may not be, necessarily related to this venue, but all about you providing information and kind of being a public advocate for what's going on. So I, like you, I tested positive for the antibodies, so I'll be donating plasma as well next week. So thank you, Alita, for pushing me to do that, to help find a cure. So I'm curious to know, we started, a momentous day today after 98 days, reopening the city. 2 weeks, restaurants are going to open. Hopefully sometime in July, non-essential businesses are going to open. I know what the steps are, especially for small businesses. You have to test employees as they come in every day, by temperature test. If an employee runs a fever, they need to go get COVID tested. Is that still the case? Or I'm trying to understand what the process is, when employees start to go back to work. Yes,
Today is a momentous day. Phase 2 could be as early as 2 weeks away, but I think there's a chance that it takes a little bit longer to get to phase 2. It's really going to depend on the health data, and if we really just see no uptick at all, it makes it more likely that the next stage happens quickly, potentially as quickly as 2 weeks. But I think you should prepare that and some leaders of some health leaders and the mayor himself have signaled that it could be closer to 4 weeks on phase 2. So I know we're all anxious for that. But yes, symptom checks are going to be a part of life in every workplace. And that is a temperature check and potentially also a quick question or two about how people are feeling. And it is true that there are people who feel perfectly normal and have the virus and are contagious. So that's not going to catch everybody, but it will probably catch a significant majority of people who are contagious. And there are no touch temperature checks. So it's a pretty unintrusive process. And I think you should expect that in every workplace. You should expect a lot more changes too. As much as possible, plexiglass barriers up between staff and the public, or between individual staff members. I would hope, as Steve said, a lot of improvements in ventilation, a lot more open air ventilation, a lot more air conditioning systems which do circulate outside air, an obsession with surface cleaning. And I think pretty soon, a lot of new technology that allows you to do just about everything with no touch. So you know how right now in a bathroom you can, sometimes you can dispense soap with no touch, or the paper towel with no touch. So I think you might start to see that on elevator buttons, on opening doors, potentially on vending machines, on ATMs. I think that you're going to see in public settings and in workplaces a lot of changes that can avoid touching surfaces if possible. So not a return to normal. Some people call it the new abnormal, and it's what it's going to take, at least until we have a vaccine deployed.
So so I appreciate that. So you go get tested. How long do the results take now for turnaround for testing?
Too long, Brian. Right now, realistically, 3 to 5 days. And again, you might be contagious during that time and walking around.
Right.
3 to 5 days later, oops, you get a positive test. And only then does the contact tracer call you. There is.
No,
please, go ahead.
No, I was going to say, and just the last thing that I had was to return back to work. Did I understand that you had to test negative twice in a 24-hour period?
Well, let me say one or two things more on testing because the technology is changing and we're going to have better options soon. There is a machine that gives you a 45-minute result. The city's health department is buying a bunch of them, and some hospitals are going to have them. I think we're a ways off because they're so expensive from every workplace having them. But there's also, by the way, probably going to be a saliva-based test that's going to come on the market where you don't need to have a professional staff person administer the test. You can spit into a cup. Now, that doesn't really solve the quick turnaround problem, but it does ease it. I think there might be some places that require the 2 tests. The delay in results is a problem. My understanding is most workplaces are going to rely on the other measures I mentioned, looking for symptoms, building in social distancing, a lot of surface cleaning, etc.
Got it. Okay. Thank you.
Okay. Thank you, Brian.
Will?
Yeah, next is our Women and Families Co-Chair, Margaret Price, Peggy Price. Peggy, you may have to push a button to confirm a meeting.
Thank you. So I'm wondering, we've been doing some research about the food problem that Dr. Full-of-Love was talking about. And what we have found out is that there are at the moment no food pantries in the CB8 district at all. So, so I was wondering whether this is the story throughout the city about the lack of food pantries or the shortage of food pantries to help people who are in need of food because of the pandemic. And how do we find the resources for these people? Is the city looking at this issue
Yes.
of lack of food pantries and support?
Yes. And New York Common Pantry, I guess, is right to the south of CB8, but I think serves CB8 to some extent. Perhaps someone can clarify that. I know it's not in the board exactly. The food pantries were already under increasing stress prior to the pandemic, and it has been absolutely an overwhelming level of demand for food that unfortunately is increasing now because of the economic shock. And we've done, as Dr. Full-of-Love mentioned, a couple food giveaways in my office, and I mean, it's been the demand has been many times more than we could possibly serve. We had most recent one, we had a line maybe 6 or 7 blocks long that we tried to keep social distancing, but just to give you a sense of the challenge out there. And the Department of Education, of course, at its food hubs, and there's about, I think, 500 of them. There are a number in CB8 are offering free food every weekday. It's food to go, grab and go, and it is breakfast, lunch, and dinner. And adults are eligible too. It's not just for kids, so it's for families. The food they're giving out there is, though, a peanut butter and jelly sandwich and a bag of chips. And we need to offer people more wholesome, fresher food, produce where possible, not just, packaged and processed stuff. And that's where food pantries really are important, because they can do that. They do that. But they're underfunded. And so the city has put out a $25 million kind of emergency funding for food pantries. And it's supposed to be deployed down to smaller groups And in neighborhoods where there isn't one physically, there should be mobile vans, and some of the food pantries are offering that. This needs to be a priority. There needs to be money going into it. There's really no alternative. There does need to be mobile vans. We have one that comes to my office. Obviously, I'm on the west side uptown, but some of the larger pantries have bought trucks, basically, repurposed RVs, and they're amazing. And that's the kind of thing we probably need in CB8. And I'll see if I can talk to some of the folks in your neck of the woods about that.
Thank you. That'd be great.
Next is Lynn Strong. Lynn is the chair of our Roosevelt Island Committee.
Can you hear me?
Yes.
Okay, so this is actually, thank you, Peggy, because what I wanted to talk about was pretty much what you were talking about. And that is going forward, I think what we need to advocate is focusing on community centers that distribute food, and that maybe even going forward with what, depending on how bad the economy gets, maybe they even have food kitchens. And that the one thing that what we identified on Roosevelt Island really early was hungry people are going to be angry people. So we were able here in this community to affiliate with a food pantry in Queens that has been making weekly deliveries to Roosevelt Island. And they have distributed somewhere since the start of the pandemic, almost 10,000 food bags on Roosevelt Island. And I'd like to say that keeping people from being hungry, actually, we had a fantastic protest over here last Wednesday where about 500 community members came out to the Black Lives Matter protest we did, and it went fantastically. And I think some of that is because the people in the community were feeling supported by both the mask efforts that we were doing here and the food efforts that we were doing here. And I think going forward throughout the throughout Community Board 8, we've got to target a couple places that are community centers. And not only does that bring it to a grassroots level within the community, but it also gives the people within that community a sense of feeling taken care of. So I think that that's something that I'd really like to push for Community Board 8 to advocate for. And then those places could also be used for some of the health information and disseminating, health issues and things to really get a sense of what that community needs. So I'd just like to throw that out there as, from my understanding, the way that we handled the food distribution here on Roosevelt Island is they're using that as a model in other neighborhoods to try to support and uplift those neighborhoods. And so I'd like to encourage us to figure out how we do that in Community Board 8 and maybe take it out to some of the other community boards.
Thank you. That's a big yes.
Thank you, Len. I don't think you really asked a question. I think you just made an extremely powerful and important point, and I'm with you all the way on that. And I want to thank you for everything you're doing to lead on Roosevelt Island and have been doing for so long. But we'd love to support you in the effort to get food to people who need it too.
Great, thank you.
So next is our board chair, Alita Camp.
Thanks, Will. Thanks, council member, for being here and also for donating plasma. It's so important. But I wanted to ask you, if there is a surge in August, what will be different about the city's response? Is it putting ventilators aside? Will it keep the expanded definition of who's eligible for testing that it has now? Will contact tracers be expanded? Will there be more PPEs? What about hospitals? What will be different so that all the vulnerable people or the people who don't trust government, the people that's had the disparate impact of the virus will be better served?
Well, thank you, Alita. And of course, I'm not making a prediction of another surge in August, but I do think we need to grapple with every one of the questions you asked in case there is one in August or the fall. as there was in 1918 and other pandemics. So in many respects, we are going to be better equipped. The city's already starting to stockpile PPE in a way that we hadn't prior to this. I mean, the impact of having virtually no testing capacity in the early stage, the bulk of which lies directly with the federal government. I mean, that was devastating, and so we'll be much better off to have. I mean, we're already probably at 50. I would say at least 50 times the capacity we had for testing in early March, and it's still growing. I'd like to see us triple it again, honestly, and I hope we will. And there's also a move to stockpile ventilators. So we are going to have some assets. But my concern is really public buy-in at that point. And we just had a pretty united city in March when we shut down. And this, I think, a remarkable across the board commitment to that effort, which was pretty extraordinary. And it's why we crushed the curb. And I'm worried that it's going to be harder to get that buy-in if and when we need another intense round of social distancing.
Is the city work? And I'm sorry if I interrupted you. Is the
Please,
city
yeah.
working on messaging for that, and thinking about how to get the word out or how to convince people to stay in? Because I know people are acting some as though it's all done, or they're done with the virus, as you pointed out. And it is scary. And a lot of doctors predict that there will be a surge even without the reasons that people are hanging around together and not wearing masks, that it's just the nature of the virus.
It's nature of the virus, exactly. And I don't think I can say that there is at the moment a clear plan by the city to communicate about that. At least I haven't heard of one. It's not too soon to start asking for it, though.
Thank you.
Will?
Next, Barbara and Lori, you both have your hands raised. Would you like me to skip over you, or you guys can raise your questions?
Well, that's fine.
No, I didn't know. No.
Okay.
I'm fine.
Ellen Polivy is one of our public members for our health committee. Ellen, you may have to confirm unmuting on your screen.
I will say I love seeing everybody. It's been so long.
So, hi everybody. So before I just want to give a shout out to Lynn, because she very nobly said we use the global we, but really Lynn was the one that actually got the food pantry to bring the food to Roosevelt Island. And then after that, it was a massive community effort to deliver the food to everybody. But thank you, Lynn, for doing that wonderful, wonderful job. Otherwise, on Roosevelt Island, we're a little bit left out in a lot of ways. I mean, we don't have testing here. So in order for us to go get testing, we have to travel, which means, you know, do we take Uber? Do we take the subway or bus?
Problem. Yeah.
And so I have a few questions, because there seems to be some confusion over what tests to take. There's multiple tests, and should we take the antibody test? Should we take the COVID test? Which COVID test do we take? Do we take the one that's short acting? Is there a long, one that takes 5 days, one that takes 2 days to determine the answer, to get the result? One's supposed to be not as valid as the other one. The antibody tests are 50% reliable, so you could either have it or not, and you could either,
really good questions, Ellen.
Even if you take the test.
Really good questions. So the testing I've been talking about almost all evening here is the test to diagnose whether you have the virus, sometimes called a PCR test. And that's the one that we need to rally people to get, because that's how we're going to catch the virus early and connect people to contact tracers. And that test is pretty accurate. There are some challenges, like after you've recovered and it's been a while, you might have dead virus in your body, which is not a threat to you or anyone else, but could still trigger a positive test. But mostly that test is pretty accurate. And as for the delay, I think probably there's not a lot you can do to access today the very fast tests, because most of that is going, I think, to medical settings like hospitals. That will hopefully change. Now, antibody tests are important for a couple of reasons, but there's also a lot of caution needed there. Basically, I'd say there's good and bad reasons to get an antibody test. So if you want to donate plasma, that's a great reason to get a test, because more and more there's evidence that if you take plasma from a person who's recovered and give it to someone who's still struggling in the hospital, it speeds up the recovery or helps the chances of the person who's still struggling. And so that's a great reason to get an antibody test. It's also helpful to public health experts to track the progress of the virus. And you've probably heard that there's an estimate that about between 20 and 30% of the New York City population has the antibodies, which means we've had the virus. And that's a really important number to know, to understand how far we are from herd immunity, et cetera. And I understand people are just really curious, did I have it or not? And they want to know, so they get the antibody test. Here's the big caution, which is that there are false positives with this test. And so no one, and furthermore, we don't understand how immunity works exactly. We hope that if you have antibodies, you have immunity, but we don't know for sure. So no one should use an antibody test to make a decision about their personal medical care, and no one should alter their behavior in terms of social distancing and wearing a face mask because of a positive antibody test. That just, it can't be stressed enough. We don't want people thinking they have armor or some sort of, special magical protection because they got a positive result on an antibody test. Sorry to be the bearer of bad news. That's the reality. Fine if you want to get one for all the reasons I mentioned. Still, you need to wear a face covering when you go out in public. Still, you need to wash your hands and practice all that extra care. And doctors, actually, every doctor in the city got an alert from the health department saying, don't use that test to make medical decisions for your patients. So this is very serious. Hope that answers your questions, Ellen.
Well, yes, partially. The other part is, if we've been staying in and only going out to go shopping or, take a walk, do we need to get that test, or should we be pretty certain that we don't have the virus?
Well, I don't think there would be a compelling reason for you to get an antibody test. It's probably, other than donating plasma, there's not a compelling reason for anybody, really. Although I mentioned some others that are valid. And in terms of a diagnostic test, if you have been largely sheltering at home, then I don't think there is a compelling need for you to get the test. And as I think you seem to mention, there is a risk going out in public, getting to wherever you're going and sitting in that waiting room, et cetera. So I think mostly the guidance is that the people who need to get a test now are people who are potentially exposed because of their job, because of their social activity, because they've been to a protest. Those are the folks who we want to ask to get tested and get tested repeatedly. But for you two, if you've been sheltering at home, probably it's not required that you get that test.
Okay, so one last question. If we want to go to a dentist or a doctor, yes, or something, or the hairdresser or someplace, right, that's opening up, should we be getting tested before we go?
Dentists are now open. Hairdressers are not yet, although they potentially will be in the next phase. Just to clarify that. It is not currently recommended that you get a test before visiting the dentist and or a medical appointment. And I see Will put in the chat that elective surgeries are now, elective procedures are now allowed in hospitals. So that covers a lot, and that might mean more of you are going to hospitals and doctors and outpatient clinics. There's going to be in those settings, and I know because I went to a doctor's appointment with my son. I mean, there's so many new procedures built in every medical setting. It's really different than what you are used to. Universal PPE, a ton of social distancing, no waiting rooms like you're used to in terms of the crowds there, hand sanitizer everywhere, no shaking hands with your doctor or the nurse. So I don't think that health officials would say you would need to test after that that medical visit, although you certainly could. I think that doctors would say be really careful to self-monitor for symptoms, and frankly, if you're seeing a medical provider, you could discuss this with them based on your personal vulnerability and their advice. Always best to talk to someone who knows your personal medical history.
Thank you. Can I ask one more question?
Sure.
Because actually has to do with public health. Somebody sent me a sign that's up at City College, and it's a beautiful, it's a really nice sign that says, due to the concerns around coronavirus, do not lower your guard. Do not confuse recklessness with bravery. Do not believe that we are, any of us, made safe by anything except vigilance and care. And then they go on to say, may our joint fight against the COVID-19 pandemic bring everyone to recognize the great need to reinforce brotherly and sisterly bonds. And this was put out by the City College of New York.
Beautiful.
It's a beautiful, it's a really
It really
nice
is nice. Maybe he'll send the
sign.
link to us. Yeah, that's great.
That's really
Well stated.
Good.
And I do apologize. I'm gonna have to leave in a minute or two. I'm also late to the 8 o'clock Zoom.
This was wonderful. Thank you so much.
Well, it's my pleasure.
We'll just continue this
Barbara.
again. I think there's still more questions, and maybe we'll have another one like this, Mark.
Well, I'd be happy to. Unfortunately, this fight is not over and won't be for a while. So
yeah.
No, and when it is, we'll have discussion about what is next and how our hospital's going to change. And it's not just, I was going to ask a question about the Upper East Side hospitals did very poorly also, and we're running out of equipment and so on. So we'll have a lot more.
They weren't the worst. They weren't the worst, Barbara.
I'm not saying they were, but they were not
no hospital was unscathed.
That's right. That's right.
That's for sure. Wonderful to see all of you. Thanks for this great discussion.
Thank you so much, Mark.
Thank you for inviting me.
Thank you so much.
Okay.
Great.
All right.
Thank you.
Be safe, everyone.
Be safe.
Bye-bye.
Thank you.
I think we still have two more questions, even though the panelists left. I don't know if we want to just hear what the questions were so we can maybe look into it on our own.
Yeah.
Yeah. Wilma? Wilma, can you hear us? You're unmuted.
Yep, we don't hear too well.
Hello?
Hey, Wilma,
Yep.
we can hear you.
I'm asking a question about, well, the person is gone. I was going to ask about if a person is very high risk, as myself, when would it be safe for me to feel free to go out? I mean, I can use my common sense, but it's a lot of information out there about what to do and what not to do, and it's very hard to know what's right and what's wrong. The discussion that Levine gave tonight and the other panelists was a lot of information, and the questions that people asked made it even more so scary to go out or stay in more. I was wondering if anybody else is in a predicament where they don't even know what to do anymore. And are people going out now because things are getting better? And if they're going out, do they still have the same fears?
I think I know what Mark Levine would answer, because I listened to another Zoom that he had, and he talked about risk. And he said this today also, that there is judgment. And I guess the safest thing is to never leave your apartment and not do it. But there's a practicality that's associated with that. And he talked about the fact going out with a friend and taking a walk in an open air is a less of a risk factor than going to church where everybody, every is taken and people are singing and so on. So he has, and he's going to send it to us, and maybe I hope Will will put it on the website. Risk factors. What is, I remember, somebody said, well, can my child play with anybody? And the answer that he had from some speaker was, get a buddy. Like, don't play with 22 kids, but find a family that and you're limiting it. So everything is a matter of risk. And I think that part of the risk, if we stay in, is a psychological thing also. I think many of us say we can't keep staying in, but wear your mask, try to walk and allow, don't be part of the bar scene, etc. And I know that's his answer, because I heard him today, and I've heard him in the past say the same thing also, that risk was his word. Any other questions? Thanks, Wilma.
It's also hard to think about the future with possible cure for this virus, and who's going to get it? I mean, the system that I'm in, I would be on the bottom of the list to get the vaccines. It would be people that have these fantastic insurances and have money to just go any place to go get it. But a person that doesn't have the means or the right kinds of insurance, it's going to be hard to even think about getting vaccinated. So I worry about that.
I do too, and
that's why it's so.
That maybe our committee could talk about later is the cost of healthcare and how much will it cost and what can be taken care of. Maybe is something.
And that's why it's so hard. It's a big problem about it. Universal healthcare. They got to do something about that, because that would help a lot of people.
We have done it, but maybe it's time to talk about something else, maybe with a little difference along the way.
And something that's workable, possibly to be worked on. All right. Well, I really enjoyed that whole evening.
I thought very interesting. Anybody else, Will, that wants to ask?
Yeah, I think Alita has.
Thank you, Wilma. I'm going to mute you. Alita, I'm going to unmute
Thank you. This is an answer. It's not an answer, but it's a comment directed towards Wilma. I think one thing that we've learned, a big lesson from this, has been the unfair impact, the disparate impact of the virus on people in different communities, people of color. And there should be a lot of pressure on politicians to exert pressure on the pharmaceutical companies that when there's a vaccine, it's distributed in a fair manner, and that people who have been vulnerable or impacted to a much greater degree have equal access, if not better access. So I think I would anticipate that the community board might have a thing or two to say about that, but that it's certainly something that hopefully, at least in New York City and New York State, the politicians are not going to sleep through.
I would like to ask Alita, and I don't mean to put you on the spot, but we did
Uh-oh.
have forums, so, I mean, you could, so please, but we did have a forum, actually 2 forums, but one, what was it, about a year ago on the New York State Health Act, which is basically a New York State universal. And we basically tabled because there were so many open questions that I know I talked to you and we felt it's best, don't even bring a resolution up or anything. Do you think we should re-examine some form, and maybe this is a discussion we'll have at a later time?
Let's
what
talk
would be
about
the step? I would like to talk to you about it in the
Yeah.
committee about it, because I think this is the next thing that will be so important is
Yeah, let's talk about it offline because I'm not sure that
whole business.
some of
Yes,
the
we'll talk
issues,
about it.
yeah, will go away, but I'm happy to talk to you anytime,
Yeah,
Barbara.
I think
And
that,
thank you. Thank you for asking me.
right, because we had discussed it, I know. Any other questions? Any?
Ellen Pollovy has a question. Ellen, you may have to push a button to unmute yourself.
And can I just tell Ellen, I did, just for whatever reason, I was passing by City MD and I felt if I'm co-chair of the health committee, I should know what the different tests are. So I went to City MD and they said, which one do you want? And I said, I don't know. And they gave me both. So
Maybe I can come by to your City MD and go for a walk.
I keep saying drive over and we'll take a walk around the block with masks on. So please.
Sounds like a good idea. Okay, so I just wanted to kind of nudge a little bit with this New York Health Act. I know that you want to put it off in a separate offline discussion, but I just want to bring it out into the discussion that's coming up lately with white privilege and how how healthcare is integrally involved with the racial disparities, and how I've been reading a lot today, especially, and yesterday, about the how white people are feeling pushed to do something now, and we're feeling appalled and disgusted by what's been happening. And that's true. So now what I think we need to and then the discussion led to taking it a step further and putting your action where your disgust lies, which is actually doing something that is more uncomfortable and possibly giving up a little bit to bring everybody into the fold, which would mean universal health care. And so
Or some form of it, at least,
when we're
anyway.
talking about that, we need to think about, the health committee really needs to think about universal health care again in the context of this.
I agree. I would like to talk to Alita about, see what her guidance is, and then we'll talk about the whole committee if that's okay with my co-chairs and everything. I need to know,
That's
you
fine.
know, feeling about
We
this.
can table this discussion. That's fine. I just want to put it out there about why I think this is really important to be doing this again.
I think that the time there's different times in life, and
exactly.
Right. I think you're right. I agree. Well, are you ready for bed?
I am fine.
Is there more questions, or?
I don't see any more questions. Last call, if you want to have a question or discussion on an item, raise your hand through the participants menu. If you had a question, I put this in the chat. If you had a question that you didn't get addressed by the council member's office, send us an email. The email is info@cb8m.com. You can send us an email. I'll get it to Mark's office and we'll get an answer to you for whatever question you may not have had a chance to ask.
And I would love to see the risk things that he has. I meant to ask him for it before. I would like to see what he has. Okay, now can I tell you one funny thing that happened? Somebody on the call had asked him, what if you want sex? And the answer, the woman was just so cool. And she said, well, we prefer if you self-sex, but if you can't self-sex, try to find one sex buddy along the way. And it was like so matter of fact and clinical that it was almost shocking how she said it. So there's advice on every aspect of life, I guess.
There is a fact sheet for that on the city's website. I'll leave it at that.
Okay.
Alita did have a raise her hand to have a question or comment.
I did. Thanks, Will. I just want to tell you, Barbara, and for anyone else, that the risk list will go onto the CB8 website through the updates that we're posting on COVID, because that's important and more
It is. It
information
was
is
a very
better.
interesting Zoom that I attended.
Yeah.
Blown away. One
Thank
day
you.
we'll need to
Thank
have
you
the
for
rest
letting me
of
speak.
all the Zooms that we are doing at this point, but maybe not yet.
And we can also link to those resources in the minutes as well.
That's a great idea.
That's great. Yeah.
Thank you. I think
Thank you.
we call it a night.
Good night.
I enjoyed
Motion
it.
to adjourn,
I
anyone?
hope everybody did.
It was a great meeting, Barbara,
Motion to
and
adjourn.
Rebecca. Thank you
for coming.
for educating
you.
all of us. Thank you. Good night.
Great,
Bye.
everybody.
Bye.
Bye-bye. And thanks, Will.
You're welcome. Thank you, guys.
Thank you, Will.